Hey, it's Joshua. As you may know, Nigeria's one of the worst health outcomes in the entire world. For example, maternal mortality is double the global average. Child mortality, astonishing. Vaccination rates for COVID, pneumonia, tuberculosis, horrible. Just overall has very poor health outcomes. And the less known reason for why this actually is its health system. The average facility in Nigeria looks like this. So overcrowded, stuff everywhere. Only like one or two health workers that are present, and oftentimes very little infrastructure or resources needed to actually give a high quality of care. Now, the reason for this is actually a gap in the actual financing system of how the health system actually works in Nigeria. So what happens is health workers paid a salary from the government that owns the region of where they work in. And the issue is with this current system is with the salaries, they're often delayed and often very inadequate in their actual amount that they're paid in wages. And so imagine as a health worker in Nigeria, you're paid barely anything, and it can be delayed by months or even years to actually get your payment in the first place. Obviously, it's very hard to be motivated to actually work there because you're getting screwed over for your work. But also another issue is when you're a worker in these facilities, you're asked to pay for your own stuff as a facility. So you have to pay for your own drugs, you have to pay for your own equipment, you have to pay for your own resources. And so you're supposed to use your salary for this money to upgrade your facility to give a high quality of care to your patients. But obviously, if you can barely afford to pay for yourself and your own compensation as a worker in this system, you can't afford much money for drugs and facility stuff as a worker. And that's the issue here. The quality of care is so low because they can't actually afford to give a higher quality of care with better resources because they can't afford it. There's no money coming in to actually pay for this high quality of care needs like drugs, bed nets, washrooms, etc. That's where I come in. I'm working with local experts to deploy a new model at new facilities in northern Nigeria and called performance-based financing. And the idea here is that we can create financial incentives to these workers to give a higher quality of care. So the idea is there's a set of indicators that are quantitative, like number of vaccinations, number of skilled birth deliveries, number of postnatal care visits from patients. And if they meet higher indicators, so more vaccinations, more skilled births, more postnatal care visits, they get paid more from this model as compensation. And so by doing this, not only are they motivated to give a higher quality of care because everybody loves more money, but also the money can be used as a positive feedback loop to raise quality of care by buying drugs and buying resources and buying equipment. And in doing so, it's a cycle of increasing quality of care while motivating staff workers to actually give a higher service quality with money as the incentive for doing so. And it's actually entirely self-sustainable because it uses user fees, but I'll spend that a bit more in my room on the Gathered Town for the demo day if you want to hear more about that. But the idea is we can incentivize a higher quality of care, and in doing so, it reaches the vision of a higher health outcome in Nigeria in the first place. What does that actually mean? Well, Nigeria right now, as I told you before, has poor tuberculosis rates, poor maternal mortality rates, vaccination rates are horrible, whatever. It's a very poor health, outcome-based country. But if you can raise the quality of care facilities for healthcare and raise the health system quality as a whole, we can then raise these health outcomes. Because if we can give more vaccinations, if we can give more drugs, if we can give a higher quality care in the first place, we can then treat and prevent these diseases that happen so much in Nigeria and therefore make an impact in the country. All right, if you want to chat more, I'll be on the demo day Gathered Town link in my room. Just want to talk to you there if you want to have any more questions. And yeah, thanks for watching.